What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast. Welcome, everyone. I'm very excited to bring to you today Ryan Nall, who comes to us from the West Coast, and apparently they just went through a little bit of a heat wave. He was telling me before we jumped on the podcast today that they just had 85-degree weather, which for the Pacific Northwest is unbelievable. I'm very much looking forward to a little bit of heat. I don't know if it's quite that much heat that I'm looking forward to, but nonetheless, I'm looking forward to having summer right around the corner. He is in a position where he is now the Washington Regional Director for Proactive Physical Therapy Specialists. This was a role he took on right at about the beginning of the pandemic, and we'll unpack that a little bit today and a couple other topics. As we look to meeting him in person from an R2P Academy team standpoint, we'll be going out there in a couple weeks here to host our Blueprints course. But nonetheless, Ryan, welcome.
Thanks a lot for having me on. Really appreciate it.
Absolutely. So, let's dive right in. You could not have asked for a better time to jump into a new role. And obviously I say that a little bit with a sense of sarcasm there, but new role, regional director, 6 clinics right in the middle of a pandemic. Tell me what's going through your head and maybe some things that popped up during that early time period.
Oh yeah, it was a little crazy. So that was a position, our previous CEO retired last May, and it was a position that I'd been looking forward to taking on for a long time. So the timing just worked with that. And my buddy and I, Ernie, he actually manages our Oregon clinics. So we jumped into it as a team. So he manages our clinics in Oregon. There's 9 of them. I do our 6 Washington clinics. So we were preparing for a year. We just weren't quite prepared to do it in the middle of a pandemic. So there was just the biggest challenge with just shuffling staffing, seeing who wanted to come to work, ensuring if we were actually going to stay open as a company during that early phase of the pandemic. There were just so many unknowns. So that was a large challenge, just getting us set up to be able to manage the pandemic best we could. And we did a great job. We really, we kind of got our staffing down to a point where it was efficient, and had people go on leave for a period in the beginning, and was able to bring back the majority of our staff as things opened up. And there are a lot of our patients that wanted to continue care during that period because they felt like continuing to get exercise for them was more important than just staying at home, even if that meant going out in the community some. And we didn't have a single case of COVID at any of our clinics that was contacted to the clinic. So we did a great job, just really made sure things were very clean in the clinics and got really efficient with treating all of our patients, kind of doing more with less with all of the PTs that we had in the clinic.
I heard you mention that a little bit in our conversation before we turned on the mic, and you had mentioned that you felt like it elevated everybody's clinical practice. And I kept hearing the word efficiency as well. Some things that I'm thinking about, at least with regards to our process over the past year, was, telehealth, right? So doing more evaluations without using your hands. So having to think creatively, be better at communication. Also, put people in a situation where they're potentially doing certain manual interventions on their own. Are there any things that I just mentioned that you want to dive into a little bit, or can you at least elaborate on what you meant by, that you've seen increased efficiencies or improved clinical practice?
Yeah, absolutely. A lot of our clinicians were just seeing more patients on their schedule than they had in the past. So during those times, they had to do more education to their patients of more things they could do at home to help themselves. Where maybe we spent longer times in duration with every patient in the past, and we kind of had to be more efficient to get to the most important nuts and bolts as far as our hands-on techniques and teaching them new exercises, and then educating a lot of them to do those things on their own so they could help themselves. And it's really made PTs step up and really, help them get better at educating their patients, help them really get better at making their patients kind of be able to treat themselves. And it produced a lot of good results, better results that we've seen in the past.
I think that's so important. And with education and the word empowerment almost always comes directly after, right? You're empowering people to make better decisions for themselves because you've put them in a situation where they have better information. You've brought the bottom up so to speak. You've put them in a situation where they don't always need to reach out to you or be dependent on you, the practitioner, the provider, whatever we want to call it, to potentially tell them what to do. The information has left the clinic, so to speak. So yeah, I mean, that's definitely something that resonates with myself, our team, as we're always trying to ideally put people in a situation where, they're able to make better decisions, but not only that, they're also able to ask better questions in subsequent appointments. And potentially, if you have an individual who, let's say, came to you for a knee, they may be able to self-manage a little bit with regards to other things that may pop up. That may seem like a negative from a business standpoint, but I would argue that in today's landscape, where you have the consumer who's looking to be more educated, who's more tied in to a place that maybe presents information in a different fashion, or at least is taking the time to educate them, that you also put yourself in a situation where they still think of you from a top of mind standpoint. Because I know a lot of people out there, myself included, sometimes it's like, all right, well, I'm educating these people to a higher level. Then at some point, they might not need you. Yeah, they might not need you, but at the end of the day, they're going to probably look back on that scenario or that situation and have some great things to say about it. And they're going to want to put themselves in the same environment should something come up and they can't self-manage. So, don't be too concerned that you're going to educate yourself out of a job. I mean, is that something that you've kind of had to have conversations about? So
absolutely. No, I think, and with self-management, to me, that really builds trust, and trust is the key to everything. And, if you teach somebody to be very well educated about their condition and be able to self-manage, then that's going to build a lot of trust with you as their practitioner of choice. You're going to be the first person that they come to when they have an issue in the future. So, and a lot of times I would tell my patients, like, hey, if you have something going on with your knee in the future, try these techniques for 3 or 4 weeks by yourself before you contact me. If that's not getting you where you want to be, then come to me and we'll be able to get it managed and be able to get it taken care of quickly there. So, one of those things where be educated, but also think of me if what you're doing is not getting you where you want to be. And also, with that trust, if we've taught people how to self-manage things well, and they've been very well educated in their visits, then they're going to tell all of their friends and family about the great relationship that they have with us, and that we're really looking out for them and their best interest. That's why we all get into PT, because we want to help people and we want to really look out for them and their interests so they can really empower themselves to truly be able to what they want to do with their lives.
Yeah. And it always comes up to an analogy for me. I'm a big analogy person. I think it allows me to just kind of piece things together, create associations, remember things. But I always am reminded that most people would probably rather learn how to hunt and fish than have somebody potentially always hunt and fish for themselves. There's more perceived value there. Yeah. You've created some kind of, self-sufficiency, and they're more likely to come back to the person that's kind of taught them or shown them the way, that somebody that always is doing something for them. And that we could get down a whole separate rabbit hole with more passive approaches, active approaches, but that's a perfect segue, honestly, to talk about occupational health, knowing that sometimes in situations involving workers' comp, low back pain, maybe even tendinopathies, at least in terms of how they were managed in the old times, that there were more passive ways of treating individuals in this bucket, so to speak. You've been doing more and more coursework. I know it's something that you focus on a ton. So what are you seeing in occupational health? Where is your time and energy going in terms of elevating yourself and your team?
Yeah, absolutely. In our region, we do a lot of occupational health. We've got a lot of great relationships with the providers, and they trust us a lot to get those patients back to work. And it's a different type of patient too, because, not only are you working with the patient to get better, but you're also, creating that trust with the doctor who are relying on getting them back to work, and the employer getting that patient back to work. So patient, there's a 4-way square of people all working together to get that person back to work. And with that, you really need to take a look at additional factors like how are each of the positions of the job or the types of activities they're doing influencing their condition, whether it be low back pain, tendinopathies, et cetera. And do you need to modify those as far as what they're doing at work in order to allow the correct healing environment? So occupational health is really interesting in that fashion because there's just so many different factors involved. Complex, but it makes it more fun in that same light. And kind of expanding on that, we see a lot of tendinopathies in occupational health. And traditionally it was, ultrasound, massage, heat pack, and that was kind of it. And now we're just really having to look a lot more at really strengthening the structures that need to be strengthened, lengthening the structures that need to be lengthened, get the correct joints moving, and also just teaching correct body mechanics and core stability so that somebody could do their job and not only do it with a heck of a lot less pain and improved ability, but also learn how to prevent it from happening in the future as far as future injuries. There's a big cost for work injuries. There's a big loss in work time. A lot of places and employers are already understaffed right now. So we serve a big role in that, in what we do there with our occupational health.
Yeah, that word pops up. I automatically think a couple different things. I was a TRX sports medicine instructor for a little while, and we always talked about like readiness of the force in terms of the military, right? And then you could probably apply that to police, fire, rescue. Mm-hmm. Then we go almost like industrial type environments where people are doing, manual labor. Maybe they're doing boxes on a regular basis, or they're doing something in terms of either like home remodeling, construction, something along those lines. There's a lot of different factors that go into that. I heard, body mechanics, right? There is the posture, ergonomics side of the house. You have load management. You then have different variables such as light duty, right? The reintroduction of people to certain tasks and the expectation that it's also not perfect. That they don't have to necessarily feel perfect, but that there's some kind of, baseline starting point that is okay for both sides. Yep. How do you manage the multitude of variables that go into occupational health, especially for people that maybe have had some of that more passive style of approach to them getting back to whatever occupation it is that they're in?
That's a great question. I think you literally have to take it in a case-by-case basis. So every case is so different. Example, I had a guy yesterday, UPS driver. He walks 35,000 steps a day. His most challenging route, he lifts a 50-pound box 50 times in a row at one stop. So, I don't know if you've lifted a 50-pound box recently, but lifting that 50 times in a row to his waist and above head is a lot of work there. And he got injured actually last July. It took forever to get things going with authorization. He was getting passive therapy with chiropractic and their stuff. So he was out of work from July all the way until he's actually supposed to go back to work today. So for 8 months, he was out of work. That's a long time to be out of work for that type of job. So, pretty fascinating to just see this kind of case. And then I was able to get the opportunity to start working with him for a couple months ago. And we just had to start with the basics. He had a shoulder neck injury, so we had to really get his lower traps engaged, get his scapula and his rotator cuff strong. Started doing a lot of the intro level stuff. That's funny you mentioned TRX. I got him on a really strong TRX program because that was really challenging for him. And then we started him lifting at 15 pounds, got him up to 20, and then progression over time, got him where he could lift that 50 pounds 50 times in a row. And he was confident to go back to work. But we just had a discussion the other day, like he feels 85% better, but he knows he can't be 100% because he hasn't been doing his job for 8 months. So that's okay. He'll work back up to that 100% as he goes back into his workplace and gets back to that functioning he was before. We got to a place where he's confident getting to that place, and he feels ready to go back to the workplace. Just an example.
Yeah, no, and you brought up some great, honestly, examples of like criteria-based rehab where there's clearly defined objective markers, right, or benchmarks. In workers' comp, you see that more than any other world. We can't agree on anything from a return to sports standpoint, but there's a lot of well-accepted things out there. I'm thinking about, once again, police, fire, rescue, as you mentioned, the more industrial side where there is a cutoff. You need to be able to move X amount of weight. You need to be able to do this X times. You need to be able to drag this for X amount of yards. And I think that allows us to reverse engineer the process a lot easier. With a clear defined end and a pretty thorough assessment, you have an idea of the starting point and the finish point, and then it's up to you to kind of figure out where to best insert yourself. One of the things that does pop up, and you mentioned it already, sometimes with people is tendinopathy and rehab for tendons. We've gone through this really almost like an evolution in terms of how you treat these particular ailments or pain syndromes, whatever we want to call them. What are some things that you're spending more time on? And where have you maybe recently shifted from with regards to how you handle a tendinopathy?
I mean, it's a very good question. I think that there's still a fair amount of different ideas out there about that. So I'm in the middle of taking a manual therapy certification with evidence in motion, which has been awesome. And this topic came up a lot because, there was a big push for the eccentric program for tendinopathies, kind of the early 2000s. That's when I graduated PT school. And that's what you did. If you had Achilles tendinopathy, you'd essentially be doing 3 sets of 15 of eccentrics. And, that's twice a day, that's the program you had your patients on. There's a new trend called heavy slow resistance that we studied in our manual therapy group, which was essentially, instead of doing eccentrics, also focusing on the concentric and isometric, just essentially normal weightlifting, but taking control and focus, also paying attention to that eccentric phase, but reducing the frequency to 3 times a week, allowing that tissue to heal in between those days you would push it. So kind of interesting, different philosophy for managing these. And some papers we looked at found that the heavy slow resistance actually got some of better results or similar results to the eccentric, and people had better adherence to the heavy slow resistance than the eccentrics because of potentially some of the flare-ups initially that the eccentrics could cause with. And I ran into that too. So when I start with the eccentrics, sometimes I'd find that, patients would get so sore from doing those programs, their docs would almost want to pull them out of PT, especially if it was out. They're like, what are you doing to my patient? They can't even do their light duty now. So I've personally had a little bit more success with the heavy slow resistance. So I feel like people don't get flared as much and it still yields similar results. But at the same time, with that being said, I have certain patients that don't respond as well to that. And I'll put them on an eccentric program and they do really well with that. So I think there's a lot of different programs out there and philosophies out there, and it's truly trying what you feel like is going to work best for the patient and then seeing their response and continuing to adjust your plan of care to make sure they're responding positively and how you expect them to respond. So that's kind of where I've landed with that.
So many different things go through my head just listening to that. One, how did we ever think that it would be enjoyable and that somebody would sign up regularly to do 15 reps of eccentric activity? Like, I'm sitting here and I have no complaints. And I'm like, that sounds awful, right? If I'm doing 3 to 5 seconds of eccentric work potentially for 15 reps, yeah, that sounds brutal. I might only be able to do like 1 set. So just thinking back on it, I mean, I'm of the mindset of you that I'm trying to find the best way to insert myself. Oftentimes I will dive into different positions with regards to isometrics as well. So knowing that isometrics oftentimes is not going to put people in a situation where they have complaints of DOMS or of soreness, as long as it's appropriately introduced. But I find myself trying to, let's say there's a patella tendinopathy, find a way to find a provocative position if I'm doing either an open kinetic chain or a closed kinetic chain movement, and then doing the isometric around that joint angle particularly, right? So if I can come up with some kind of a sensitivity, then can I make it a little bit easier? So maybe the sensitivity is a little bit less or tolerable. We always try to shoot for like that kind of like mild, moderate, not something that they're going to describe as maybe being painful, but more of that achy or that comfortably uncomfortable discomfort. Are you going to be able to hold that for say 30 to 45 seconds? And ideally we want to challenge them just enough that maybe they can't do it for 2 minutes, but maybe they'll be able to do it for another 10, 15, maybe 20 seconds if we ask them to, but trying to be in a situation where we're not giving them that 10 out of 10 isometric activity. So for that, I'm thinking of everything from being on a slant board to potentially some kind of a wall squat, or if I have access to it, doing certain things where I'm seated and we're doing more of an open kinetic chain, long arc quad type of activity where I'm pushing into something, right? A lot of people, might be familiar with that with some of the, the quad index testing, where people are pushing into a variety of different implements to measure force. Is that something that you have kind of messed around with, isometrics? I mean, I'm thinking for Achilles, I'm thinking about whether or not I'm completely up on the top of my toes, or maybe I'm on a step and I'm actually holding an isometric with my heel below. So I'm in a more dorsiflex position. I could do that a wide variety of different positions. And I think that's sometimes a very, very nice precursor to that eccentric activity.
No, that's a very interesting thing that you say there, just because the instructor for our manual therapy course actually was really talking a lot about isometrics. And we didn't get into it as much as we could have because the research in isometrics wasn't as much as some of the others. And I think it's kind of a really new trend that's starting to really gain a lot of traction for managing tendinopathies. So I've started to do it more, and I like what you're saying right there. I was curious to talk to you today because I've done more of the heavy, slow resistance, got decent results, but as I've done some of the isometrics, I've been encouraged with some of the results there. So when you're doing those isometrics, what's your dosing do you do? Do you do a few reps at 20 to 30 seconds? Do you do it daily, every other day? Kind of what's your philosophy on dosage?
Typically every other day, and it will be no more than 3 sets of 30 to 45 seconds. But say, for example, you have a very deconditioned individual. If you have a very deconditioned individual, eccentrics are going to be brutal. I do not want to put that person in a situation where they're just not showing up because they honestly thought that physical therapy might have been counterproductive because of the level of soreness. And I have had very, very few times where the isometric itself created the kind of DOMs that would be perceived as a barrier to somebody returning. So I definitely think about that a little bit more with people who are deconditioned. Obviously, it's great for people who maybe are post-op and have some kind of tendon repair that they've gone through, because it's a great place to generate low threshold, joint position, and muscle position neutral tension, right? Because you're generating tension submaximally for a longer period of time. And then that sets a nice base and a nice framework for some of the eccentrics. For higher level individuals, I might do a little bit of ISO work, but if it's super easy and it's not something that I would, or they would communicate to me that was challenging for them at 30 to 45 seconds, say they felt like they could have done it for a very, very long period of time, that's when I'll definitely move quicker into eccentrics, at least under the belief that they're able to communicate things that are challenging for them, knowing that your entry point, you're always trying to be so good about entry point first visit, right? What is appropriate so this person finds this meaningful, but also I don't want it to be too easy or too challenging at the same time. So some of that, as you mentioned earlier, it's, getting to know the person, matching personalities as well as it is physical characteristics. But I think that's just some of the thought process that I go through. I don't know if that makes sense.
I really appreciate you sharing that. That's really good. Some of that same philosophy matched some of the heavy, slow resistance stuff that I learned where, the goals for that was it needs to be progressive over time. You're starting with a load that they can manage, but in order to get the tendon better, you need to progress it over time. And you should also work at a threshold that should not be more than a mild to moderate pain, or you're probably not doing things the right way, which I think is something that's changed over time there. You should be working at an appropriate pain level. And similar philosophy there too, doing it 3 days a week or every other day just to give some time for recovery in between doing that there. So
do enough to create awareness, but not create discomfort, right? I always almost call it like it's like a yellow light. Hey, can we push into that caution light a little bit? I'm going to push into the caution light. I want you to feel like after you get done with the activity, also that caution light gradually goes away. And that's usually kind of that fine line that we're trying to work around. And I will say that, people with a little bit more of an athletic background or more physically active typically will understand that a little bit more. And that allows you to potentially push it to eccentrics. But you say heavy, slow resistance. It also makes me think of sleds. Is that something that you've gotten into? And I understand that's more of a concentric focus, but sometimes that long, slow buildup of tension. If I'm thinking about gastrocnemius soleus, maybe it's a little bit more of like an isometric because I'm not going through a ton of plantar flexion and dorsiflexion, but especially with regards to like a patellar tendinopathy. I mean, I'm going through very, very slow, potentially heavier resistance, building up tension through the muscles surrounding the knee joint.
Yep. And we have a push-pull machine in our clinic it's a cable system, but we got a push-pull bar that accomplishes that really well. So
awesome. Awesome. Yep. I'm going to go into a hot button topic here to kind of head us down the home stretch. Manual therapy course and tendons. Explain that a little bit. Just provide the listeners with a little bit more context. I know that we eventually, or we at one point, like it was like cross friction. Now we've definitely shifted towards more of an active-based approach, but I am curious always to see what people are being exposed to.
So I would tell you this, I'm ASTEM certified. So I may be a little bit biased with this only because I've been doing ASTEM for long time. I've been doing it for 12 years. I was kind of the second guy in Vancouver that was doing ASTEM. I've seen some good results from it. However, I feel like ASTEM only works because of the exercise you're doing. It's almost the precursor that gets the tissues ready for blood flow and changing some of the fiber types in there that have got injured, basically allowing some of my patients to do exercise better. So I do feel like early on when you're dealing, especially with a chronic tendinopathy, that it can be super helpful to get your hands in there and just work on seeing if you can add a supplement to the exercises. But really the exercise you're doing are the key, and the active therapy is the key to them truly getting better. Because I feel like if I go in there and do massage or ASTEM and they don't do anything as far as exercise, they never actually make changes. That tissue loves to just rebound right back to how it was before, which is weak and tight. So you could, if people are just coming in for massage, it's never going to make any change.
I think a big thing that I've been thinking about with manual therapy more and more is sometimes it just provides a window of opportunity where something that was, let's say, mechanically sensitive, I had a movement sensitivity, maybe I do a little bit of hands-on or something with an instrument, and I go back to that activity and there's a desensitization, right?
Yep.
The word that comes to mind is this neuromodulation, right? I am modulating potentially some sensory receptors that allow that person to experience a movement in a manner that is less painful. That is positive. I think sometimes the narratives that get kind of attached to manual therapy are problematic. They're not as accurate. I think we can probably both agree that they're going through this transition, right? We're still trying to figure out, okay, why when I rub something, does it potentially feel better, right? It's no different. I shouldn't say it's no different, but I always think about a young person who falls and you rub their knee and they go, oh, it feels all better now. Okay, well, there's something there. And people would like human touch. And then you see grooming with animals. Like there's something very calming. And maybe it's on a systemic level. Maybe it's localized. I think we're still learning a little bit more about that. But regardless, I appreciate you sharing that perspective. And this will kind of be like a little bit of a close, but what are you working on personally and professionally in 2021? We are, maybe you don't feel the same way, but I feel like we're on the home stretch a little bit. I can kind of see the light at the end of the tunnel with regards to COVID. So are you starting to think forward? And if you are, what are some things that you're thinking about or already working on?
Yeah, I mean, one of the first things is just getting all of our PTs in our clinics back on the continuing education train. 2020 was really hard for us because people weren't able to do much. So there's been a really big excitement around getting back into courses, getting excited about learning new things. Learning never stops is one of the biggest values for our company. So I'm just excited to just get people trained up again, especially like the stuff you're doing. I'm really excited for the course that you're doing coming out here, and just getting people feeling good about helping people again in a more normal environment. Last year I feel like it was just such a tough year, and people just kind of got through 2020. And now I feel like as things are kind of becoming more normal, people are getting excited and having a lot more fun at work as we get to help a lot more people. So just really having that fun environment and that excitement in our clinics, knowing that everybody's really being able to help a lot of our patients again as we're starting to get busier. And personally, getting back into shape. I got a little out of shape when I was in COVID, to be honest. So, put on about 10 or 15 pounds, just not eating the way that I used to, exercising in a different way. So I've actually been in a TRX workout program every morning, which has been great for me. Put that up in the garage. It's so awesome to just, not take up any space. So that's a big part of me. It's just getting back into good shape so that I can absolutely practice what I preach and, just feel better, which has been a great thing. So my wife and I did the Whole30 diet. We made it through that, which was incredibly challenging, but made some good changes. And then this is just a good follow-up to that.
Yeah. And I mean, you have two little ones. So if there's any motivating, factors there, I can imagine being able to, I don't know what age they are, but I'm sure there's sports going on and physical activities and obviously trying to be able to keep up with them and not to go down a separate rabbit hole of nutrition. I'm a big Whole30 fan. It was transformational for me. Just realizing that my affinity towards cow's milk was problematic. I mean, the moment that I got rid of drinking, pretty standard milk every day, I got rid of my eczema and a lot of GI related issues that I was having. So I'm a big believer in elimination to then add back in. And I don't want to use the D word because I don't view that as a diet, so to speak. It's more of like self-experimentation. And putting yourself in a situation where you're learning how your body actually responds to certain food groups. And it's especially because I think nutrition, I think we all can agree, is incredibly specific to the individual. And it puts you in a situation where you have really no choice but to learn, listen, and then move forward with information that you wouldn't normally have had.
No, absolutely.
Right? I mean,
yeah. And I mean, I'm finding this more in PT. It's, we work a lot with inflammation. I'm just seeing how people's nutrition more and more we're finding is influencing their inflammation in ways that we didn't understand before, where, you could be doing all the right things as far from an exercise standpoint, but can't get their pain or their inflammation controlled. That could just be something in their diet that's contributing to that maybe you haven't addressed. So I think that, nutrition has a large role and will continue to even have a larger role in what we all do in our profession. So that was a fun process for me to go through with the Whole30. It was pretty challenging. About 3 days in, my wife and I we did it together, which was huge, just because I think having both of us holding each other accountable was a nice thing. But we were just irritated because, we live in a country where we're afforded a ton of freedoms, and not to have the freedom to eat anything you wanted to was an interesting mental challenge to get through. But then once we got through a week, it was like, oh, this is easy, and started, making dinners together, and it kind of became more fun. And I've eliminated dairy from my diet since then, and just changed my diet in a positive way. I don't practice it completely, but there's certainly been a large lifestyle change.
Yeah, it's been a big shift. And I think if anything, you become more mindful of how you feel after consuming certain foods. It's not to say you go 100%, but let's say you were incorporating something regularly and maybe it becomes seldom. And there could be massive shifts just associated with something like that.
Yep, certainly.
So Ryan, for people who want to honestly just connect with you, maybe follow up or potentially something bigger where, hey, they're out in the Pacific Northwest and Proactive is something that maybe is a company that they have on their radar. Where's the best place to reach out to you, connect with you?
Yeah, my email is the best place. It's rnall@proactivepts.com. And or just shoot me a call. My phone number is 503-686-4110. And I'm happy to talk to anybody who has any interest in talking to me more about anything.
That's awesome. And that's the first phone number that's gone out. Nobody who's out there listening should take advantage of that. Okay. We have a man, he's got kids and a wife. All right. Nothing crazy in the morning, nothing, especially probably after about 8 p.m. Guessing that your kids are a little bit younger, right?
Well, my kid's a night owl, though. He stays up till 10 or 11. So
okay. All right.
He takes after his mother. Thanks for the opportunity. I appreciate it.
Yeah, Ryan. Yep. Thanks. Very much looking forward to having our crew out there. I unfortunately will be unable to make it out at this point in time. The weekend that you guys are hosting us, which I believe is at 10 or 11 days.
Yep.
Right. Yep. Is the same weekend that one of my brothers is potentially going to get drafted in the NFL. So it just did not work out very well. We have obviously some family coming in town. And we're hoping that day 3 is his big day, somewhere between rounds 4 through 7. But nonetheless, I'm sure at some point I'll get to meet you in person. But yeah, enjoy the Blueprints course and stay in touch.
All right. Thanks a lot, Jess. Have a great day. See you, man.
Yep. You too.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcasts or Spotify. Until next time, thanks for listening.